The fun never stops when you're breaking down health insurance policies. How's it going, everyone? I'm Joey Jingola with Jingola Insurance. And on today's health insurance break, well, we're going to continue to get our hands dirty and dive headfirst into breaking down the new marketplace plans available through healthcare.gov, Obamacare, healthcare reform, whatever buzzword you want to use to refer to it by. We're going to keep the party going here and really dive into another plan that one of my favorites. I think you're going to like it. Today we're going to be looking at Medical Mutual's Market HSA 2000 Gold. So of course, at any point in time, you start to feel overwhelmed about the information that I am presenting. Well, I just want to invite you, of course, to do one of two things. One, you can just cut to the chase, send me an email, pick up the phone, whatever you want to do. Let me know exactly what it is that you need help with, and I will obviously work this specifically to your situation. Or if you would like a less invasive approach, you do have the option to download our very free video series, How to Navigate Obamacare's Health Insurance Marketplace, specifically here in Ohio. So you can go ahead and grab that after you're done watching this breakdown, and it's going to walk you through step by step of all the different processes that you do need to go through to make a very solid and sound decision. And there's one video in particular that will really work together nicely with what you're about to watch. And that's going to show you the actual dollars and cents of this plan, specifically the HSA 2000 Gold. We're also going to compare the other plans that appear on my Best of Ohio's Health Insurance Marketplace list and actually prove to you which one is going to be worth your money. So you don't want to miss that. You can grab that in this video series here. You'll get 5 videos over the course of 5 days. Break it out for you so you don't have an overload on this stuff, but you do have that option as well. But what we're going to do right now is we're going to jump behind the computer here and actually take a look at the summary of benefits for the, again, Medical Mutual's Market HSA 2000 Gold. So without further ado, let's go ahead and move on behind the computer. All right, so here we are. We're going to take a look at the Med Mutual Market HSA 2000 Gold. So we've got the benefit summary of benefits here pulled up, and we're just going to go and run through it and basically break it down for you, let you know exactly how it's going to work when you need it most. And we're going to start here at the very top. So we can see here, obviously this is a gold plan, and you do have 2 columns here that we're going to need to look at. You have in-network and non-network that we do need to be aware of. And the one that we're going to want to be most aware of is obviously in-network. That is your primary goal. 99% of the time is to stay in-network. I would say 100, but we don't need to get crazy. But 99% of the time, you're going to want to stay in-network. And you can see below that, our first line item here is the deductible. And it's obviously the most important thing that you need to concern yourself with outside of your out-of-pocket maximum. And they treat it as such as being the first 2 things that they're going to tell you about here on this summary of benefits. So we can see that for the deductible, we have a $2,000 single deductible and $4,000 family deductible. So you might think, well, why are they calling it the HSA 2000 Gold? Well, the 2000 represents the single deductible. If you're buying it on your own, you would have a $2,000 single deductible. And that means deductible is just the fancy insurance word for money that you have to pay up front. Now, what that means is that when you add 2 or more people to the health insurance policy, then it becomes a family plan. In that case, the deductible, or that number there in the title, 2000, doubles. And that means instead of paying $2,000 up front, you're instead going to pay $4,000 up front. So you notice when you slide over to the non-network side of things, it gets a little more interesting, and those numbers are yet even higher, with the single deductible being $6,000 and the family being $12,000. So very important. You can obviously see how much more expensive it is when you go out of network. But as you can see here on the maximum out-of-pocket, or the out-of-pocket maximum, it's the same thing. Basically, that is whatever your deductible is, that's your total maximum out-of-pocket, or essentially how much money you would have to pay in the worst case scenario. Basically, when does your health insurance stop the bleeding, figuratively speaking, you know what I'm saying? But when do you have to stop paying? And again, here in this case, after $2,000 if that's just a plan for yourself, or $4,000 if it's a plan for you and your family. Now you will notice, however, again, sliding over to that non-network side, again, things get a little more interesting, and you notice that it says unlimited. Well, that means that you will just continue to pay for services after those deductibles are met, and we'll get down to it a little bit further, but basically the coinsurance is 50-50. So you would just continue to pay. There is no limit. There is no ceiling. It will go on forever. So again, another reason, very important to stay in network. And you'll notice the third item here is accumulation method, and that means how is the deductible accumulated? Very simple. I don't know why I needed to say that, but here it says aggregate, and basically that means instead of there being two separate deductibles for more than one person, it's just a total family deductible, meaning everybody, when you have more than one person, everybody's working towards that collective number, that $4,000. So $4,000 is that number that everybody's working to. There is no separate numbers. There is no two for one, two for another. That's what you might have run into in the last plan that we talked about, the MedMutual Market Classic 1000 Gold plan, where they do split deductibles on those plans. Moving right along here, the next line, coinsurance. And again, you will notice I mentioned it briefly earlier, 0%. That just basically means once you satisfy your deductible, then you are not required to split any bills with the insurance company. They will pay for the rest of covered in-network services throughout the course of that benefit period, or another word for saying the year. So a year in insurance terms means January 1st to December 31st. That is your benefit period. And you can see here that is going to be one of the next lines down. We'll get to that in a second. I love to get ahead of myself. Again, before moving on, you do have to notice, again, sliding over to that non-network column, that's where it says 50-50. So what I was saying there, and where that unlimited becomes so important on that out-of-pocket maximum for the non-network, is that you will continue to pay 50% of every medical bill that you incur out of network, regardless of what deductible or anything that you meet. So you will pay 50% forever on this plan. So very important. Next, you will notice your overall annual benefit period is unlimited, so there is no cap on how much they will pay. So, for example, if you were receiving in-network treatment, you satisfied your $4,000 deductible, and you had $1 million worth of services, doesn't matter. They're going to have to pay it. Next is your dependent age, or basically how old do you have to be before you can come off the policy. In Ohio, it's 28 years old. Don't confuse that with the federal law, which is 26. In Ohio, you can stay on. Parents, you can have your kids stay on whether you like it or not. You do have the option to keep them on until they're 28 years old. Or kids out there, if you're watching this, you can tell your parents, hey, mom, dad, I can stay on your plan until I am 28. You might want to come up shooting with a few bucks, though, if you're going to bring that subject up. Just a kind of FYI. And again, that is until the end of the month in which you turn 28. So whatever your birthday is at the end of that month, then you'd have to come off. Your benefit period, like we were briefly talking about before, January 1st to December 31st. Doesn't matter when you buy the policy, you will always be working on the calendar year. So it doesn't matter if you purchased it in the middle of the year, your benefits, your deductibles, your coinsurance, your out-of-pocket maximums, whatever, will all reset come December 31st. Very important to know, it does not matter when you buy the plan, always goes by the calendar. And now from here on out, you're going to notice that things are going to get a little boring, and I'm going to repeat myself a little bit. But basically everything else on this list, once you meet that deductible, once you pay for your $2,000 or your $4,000, everything here is just going to be taken care of for you. Otherwise, you're going to pay the full discounted rate for those services before that happens. When I say full discounted rate, what I mean is that when you stay in network and go to network doctors and facilities, insurance companies have already negotiated a rate that is usually substantially lower than what you would pay if you were to just walk in off the street without health insurance. It's that negotiated rate, that discounted rate, that you will ultimately end up paying and will apply to your deductible. So the example I always like to use is for, let's say you're going to your doctor because you have a sinus infection. If you were to walk in off the street for that visit, let's say he's probably going to charge you somewhere in the neighborhood of $100. Well, because he's a medical mutual network doctor, your medical mutual will say, hey, doc, that's great that you're trying to bill our person $100, but we only allow you to charge them $50 for that visit. So instead of paying the $100, you're going to pay the $50. That $50 is going to go to your $2,000 or your $4,000, and that's the end of the story. But that's how all of these services are going to work unless I state otherwise. The one major exception here is preventative services, and you will see here preventative services. If it's a preventative service that has been outlined by the PPACA, or Patient Protection and Affordable Care Act, or Affordable Care Act, ACA, healthcare reform, Obamacare. It is all the exact same thing. If it's on that list and you're having it done at the appropriate recommended age, and most importantly, the doctor bills it as such, as a preventative service, then it will be taken care of and you won't have to pay anything for it. It's 0% before the deductible. Again, fancy insurance way of meaning free. And the same will apply for the pediatric vision, routine physical exams, well-child office visits as well, up to age 21 also are going to fall under that as well. And the only thing that's going to look a little different here is if you see non-emergency use of the emergency room. That is not, I repeat, that is not going to be covered. I can't highlight, but it is not going to be covered. So if you go to the emergency room for that sinus infection, it's not going to go to your deductible. It's just not going to be covered. And you're going to pay a heck of a lot of money for it as opposed to scheduling that routine procedure, whatever, with your doctor. Going back up here, so basically doctor's visits, lab and x-rays that aren't preventative, any type of, we have, I'll just run down the list here. We have preventative immunizations, endoscopic services, prostate specific services, pediatric hardware. All of that under the preventative services will be covered at 100% after you meet that deductible. And again, you have other procedures like allergy testing, diagnostic endoscope services, diagnostic lab, emergency use of the emergency room, emergency physician, and ancillary services, speech therapy, occupational and physical therapy. You're going to have 40 of those visits. You're going to have cardiac rehabilitation covered, 36 visits, chiropractic services, 12 visits, pulmonary therapy, 20 visits, surgery, mental health, and substance abuse, all covered under your outpatient services. So again, you're going to pay the full boat for those, the full discounted rate for any one of those services throughout the course of the benefit period. And once you meet that deductible, then Medical Mutual is going to take care of the rest of the cost. On these services where you have a number of visits attached to it, you're only going to have that many visits throughout the course of the benefit period from that policy. So you want to make sure that you know what those limits are and that you don't exceed them. All right, moving right along here. So we have inpatient services, again, all going to work the same as the ones that we listed above. You have semi-private room and board, maternity, mental health and substance abuse, physical rehabilitation, got 60 days for that, skilled nursing facility, 90 days on that, and surgery. So again, all under inpatient, all of that stuff, if you're admitted inpatient to the hospital. So again, that's all going to be covered. You just have to pay the full discounted rate. I'm repeating myself, but again, it's very important to know. And finally, you have a couple more tabs here. Additional services such as ambulance rides, durable medical equipment, and medical supplies. Home health services, you have 100 visits per benefit period. Hospice services, diagnostic imaging, so that's like MRI, CT scans. You'll probably run into those. Those are relatively common. Organ transplants and private duty nursing are all going to again be covered at 0% after the deductible. And of course, the almighty prescription drugs will also follow the same procedures. You will pay the full discounted rate for any medications that you are prescribed. Once the deductible is met, then all your medications will be paid for throughout the course of that year. So that is it. We have basically broken down line by line. It's pretty boring, these HSAs. They're pretty straightforward. And once you kind of understand how one works, you know how they all work for the most part, as it's just, hey, you got the first $2 or $4 grand, Medical Mutual is going to take care of the rest. The only thing that you obviously have to look through here is the things that are covered. Obviously very, very broad statements like semi-private, room and board, surgeries. Those are very broad statements and takes care of a lot of things. So a lot is covered here, and just wanted to break it down and show you exactly how it works. All right, so that's it. You're done. You shouldn't have any questions left about the MedMutual Market HSA 2000 Gold. If you do, like I said, feel free, reach out, send me an email, give me a call, let me know. Email's going to be right there for you. And also the phone number too is going to show up here in a second right here. And you can go ahead and just reach out and let me know, and I will go ahead and just, again, like I said, tailor this to your specific situation. Otherwise, if you don't want to do that, like I mentioned in the beginning of the video, you can go ahead and grab this free 5-part video series to help you understand, navigate Obamacare's health insurance marketplace here in Ohio. And again, it's going to walk you through every step that you need to know. and if you qualify and if you don't qualify. If you qualify, it's going to take you down one path. If you don't qualify, it's going to take you down another path. And we got some examples prepared for you to illustrate and prove exactly what health insurance plan is going to work the best for you. So feel free, click on the cover of this ebook to do so, or if you don't want to do that, you can grab the link below in the video's description. So of course, I do appreciate you taking the time to watch this video. Hopefully you found it helpful. If you did, feel free to click that like button to let others know that this might help them out as well too. But of course, as always, I am Joey Giangola with Giangola Insurance. Take it easy, everyone.